I feel like we're doing so many different things that we have a great opportunity here to care for people with their spine, for their spine care, no matter really what they need.
Your thoracic spine is actually the part of your spine that has sort of a more of like a kind of hunched component to it or a position to it. That's what we kind of refer to as kyphosis, and that's a curve that you're born with. So you're born slightly hunched over in your thoracic spine, kind of pointed forward, and then your cervical spine sort of swoops backward to allow your head to basically sit on top of your pelvis. And the lumbar spine also has that kind of swooped back sort of curve as well. When you're looking at the spine, typically straight on, you can see sort of like a curve either in the thoracic spine or the lumbar spine, or both. Sometimes it can progress slightly up into your cervical spine. There are other deformities like chin on chest, where patients unfortunately lose the ability to kind of keep their head straight up, so they kind of keep pitching forward. And then there's kyphosis, where the thoracic spine becomes, more kyphotic than it typically was or typically should be. So you can have a whole different kind of range of different deformities of the spine itself.
I take care of conditions of the spine, primarily degenerative conditions of the spine. So arthritis that causes something called spinal stenosis. Spinal stenosis is a condition where the nerves become pinched because of closing down of the space for the nerves. And that pinching of the nerves either creates pain in the arms from spinal stenosis in somebody's neck, or pain down people's legs, commonly referred to as sciatica, and that's from pinching of nerves in the lower back. What happens is, as we get older, the intervertebral discs, people call our discs between the vertebrae, they're the shock absorbers of our spine. They wear out over time. So I tell people, think of a kitchen sponge that you left on the counter overnight that was filled with water. By morning, it's going to be flattened, it's going to be spread out, and it's going to be brittle. That's essentially what happens to our discs, or shock absorbers. And as that happens, the load that goes through the spine, it gets transferred to other parts of the spine, causing those joints that connect the spine together to overgrow and pinch nerves.
Our approach here really is to, no matter what, try and get you more functional, and to try and get you back to, getting through your activities of daily living, back to your hobbies, back to enjoying your time with your loved ones. That's the goal no matter what. And we'll typically start with a pretty wide range of non-operative measures to see if we can get you back to those things.
So what we tend to do when people come in, if they haven't had any treatment, is we want to understand exactly what their symptoms are. Is it primarily back pain? And most back pain tends to be driven more by muscular dysfunction and maybe some arthritis. So anti-inflammatories and physical therapy are still a mainstay of our treatment.
So if that kind of combination of things just doesn't seem to get you better, or if it does but it's just not, kind of meeting your standards, or it's not adequate, then we can sometimes start talking about surgery and how we can best help you. When we do talk about surgeries, in the setting of scoliosis, it can be a pretty big undertaking. So the recovery from a surgery like that can be pretty significant. But I think when it's done and when it's recommended in the right settings, it can be really effective.
So we really start with physical therapy, anti-inflammatories, like many other orthopedic conditions. If somebody fails those things and they're continuing to have this buttock and leg pain, there's an opportunity to try some steroid shots, and we get people set up with colleagues of ours that are pain management specialists throughout the state. And then ultimately, if they've tried everything and nothing is really working for them, we can sit down and talk about a surgery. And that's where robotics that we use at South County Hospital may be an option for them to have their surgery done in a less invasive way. The The Excelsius GPS is essentially like a GPS, so it's not a robot in there doing the surgery for you. This isn't Star Wars or some futuristic thing. This is a tool, right? And it's a tool that helps us as a surgeon be a better surgeon. So it's just like a GPS helps you be a better driver, getting to a destination more efficiently, safer. That's exactly what this tool does for us. It's navigation of the spine using a CT scan that we obtain before surgery. It allows me as a surgeon to go plan your surgery before you even enter the room for the day of surgery. And then we execute the plan based on what we've done utilizing that tool. The benefits are clear about having more precision with the placement of our instrumentation, but now we can work through smaller soft tissue windows, meaning less soft tissue dissections, spreading of muscle, smaller incisions, less destruction of the soft tissues around the spine, meaning quicker recovery. Ortho Rhode Island, I feel, from a spine care standpoint, has really made leaps and bounds over the past 3 years, where we are really growing a team that can care for every part of what you need for spine care.